Support for Radio Friends comes from IT Como, offering computer and IT services for small businesses and residential clients. IT Como can set up remote work-at-home solutions and data security and backup systems and upgrade your company email to more modern platforms. IT Como can also help you get the most from your technology at home. Learn more at itcomo.com. Good morning and welcome to Radio Friends on Friday, July the 28th. Got another one of my friends sitting next to me, Smrita Dorairajan, doctor.
It's a pleasure to be back, Paul.
Yeah,
and
good to have you
connect with
here.
our audience.
Dr. Smrita from Truman VA Hospital. You specialize in kidneys and kidney health. But today you wanted to talk about something a little bit different, and that is?
Medication compliance. Because to explain the magnitude of this problem, nearly 66% of the U.S. adult population, which is 131 million people, are on chronic prescription medications. And on an average, they are on 4 medications a day.
Wait. Okay, break that up. So you're saying that 166 million people are on a chronic prescription. What does that mean?
So not medication like just an antibiotic or a painkiller that
it's
they complete.
It's an ongoing medication.
Yes,
okay.
It's a medication that they're on for like months or years.
Okay. Would that be like for cholesterol medication or blood pressure medication? Okay.
That's correct.
Then you're saying most of those people are on 4 different types of medication a day.
Yes, the average is about 4. They can be on more, but the average is 4 medications a day.
Okay. Now, the compliance, that's where you're concerned about. The statistic you told me, I found hard to believe, but I believe you. But it's...
Only 50% of the population is compliant with their medications.
And explain what that means.
So if like 100 people are prescribed medications, only 50 people are taking it as prescribed.
You're saying that half of the people that are prescribed medication for chronic conditions, only half of them are taking it?
Yes.
Why?
Because life is getting very fast and stressful, and they have so many things going on. Maybe they just forget, or sometimes they think it's a miscommunication between doctor and patient. They think they may just need to take it for a week, and if they feel better, though the doctor does not discontinue, they may discontinue it on their own.
So they're making the decision themselves.
Yes, and sometimes they experience side effects because things have not been explained to them properly, or they didn't expect that side effect, and then they just discontinue and forget to tell the doctor that they discontinued it on their own.
And this is not good.
Yes, because this leads to 50% of treatment failure, 125,000 deaths a year, and it's the reason for 25% of all hospitalizations.
25% of all hospitalizations are because people did not follow their prescription to the T.
Yes.
They decided on their own that they were going to stop taking this medicine because they felt better.
Yes.
But the thing is, you feel better. Just because you feel better doesn't mean that the condition has gone away. It's been improved because you're taking the medication.
Yes.
So you need to stay on that medication until the doctor tells you enough.
Yes, that's exactly correct. So they shouldn't take decisions on their own. Doctor-patient communication should be much better, especially when prescribing a new medication. You should go over with them what they can expect, what side effects are common, and if they were to experience these side effects, that they need to contact the provider and not make decisions on their own.
If you're taking a medication and it makes you feel sick, I guess the first thing you want to say is, I'm not going to take this anymore.
Yes.
But call the doctor.
Because there are always alternatives to that medication.
Right. So if one type of medication is making you sick, don't stop taking it until you talk to the doctor. Then they can prescribe a different type of medication that may not have that same side effect.
Yes, that's exactly right.
Do you see, how do you see this improving? Can it be improved?
Yes.
How can you get the message across to people? Half of them can't stop taking their medicine.
So as I said, doctor-patient relationship, that's important. The other thing is like a simple thing like a pill box. Just setting out your medications in the pill box would be helpful. Then to have a calendar or a checklist in a visible place at home is helpful. And sometimes coordinating it with your daily activities, like after a shower or after exercise or at bedtime, and to keep your medications visible near your bedside or in your gym room, wherever you're like bound to remember it, is a good idea.
Is it important that you take the medication that you're prescribed, if you're taking something once a day, like I take cholesterol medication, is it important that I take it at the same time every day, or what if it varies 3 or 4 hours in a day?
That is fine, but the same time every day, you're like bound to remember it better.
Right,
That's why
okay.
we tell patients try to like form a ritual, because that way it becomes a part of your reflex. So before bedtime, you remember, okay, I need to take all my medication.
But if let's say if you're taking it normally at 7 o'clock in the morning, but something happened and you couldn't take it till noon, that still is okay.
That's still okay. I would say go ahead and take it whenever you remember.
Okay.
Yeah.
And that's specifically for cholesterol medication. But other medication that you have to take 4 or 5 hours apart, it's important
Yes.
that you stay on that schedule. What if you miss one? You shouldn't double up and take 2 the next 4 hours.
No, I would say like if it's a blood pressure medicine, monitor your blood pressure. And if it's running high, then just take the next dose. But if it's running really high, then maybe you can double up. But
Should you talk to your doctor first?
yes, if you're not sure about anything, definitely talk to your doctor.
Now, with blood pressure medicine, do you take that once a day or twice a day?
It depends on like the duration of its effect. There are pills that you take once a day, some twice a day, some thrice a day. So it really depends. You cannot
Okay.
generalize.
But the important thing is, remember to take your medication.
Yes.
Don't prescribe on your own that you decide you're not going to take it today or you're not going to take it again because you had a side effect. Call the doctor, talk to the doctor's office or the nurse. There's somebody that will give you the correct, right?
That is exactly correct.
Okay. Thank you so much. That was eye-opening because I had no idea that 50% of
Yeah.
people on medication don't take it
Yeah.
properly.
Yeah.
Okay. Dr. Smrita Dorairajan from Truman VA Hospital, we appreciate you coming by today and sharing with us. Come back again.
Thank you so much.
Okay. Something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu. And as Anand always says, smile.